A29 in ADNIC in Abu Dhabi, and we are really looking forward to welcoming all of you. For our session today, the AI driving engine in healthcare operation, as you all know, hospital operation really today faces so many challenges, if I can say. And as part of the transformation journey for healthcare organization, operation is considered as one of the major and important part of any hospital. And as part of this transformation, as we all know, when we talk about hospital operation, we're talking about patient experience, we're talking about registration, billing, staff overwhelming, so many things. And we always consider operation as the first window of any hospital. Today, we are really honored to welcome our guests for this very, very unique session of advancing hospital operations through AI and innovation. I'm very proud to welcome Mr. Shiraz Bajwa, Chief Operation Officer in Burjeel Hospital. We're really honored to have you today with us to share your expertise from the Gulf area, from Khalij, from UAE, from Qatar. We're really happy to have you, Mr. Shiraz, with us today. And we also have Mr. Amit Batra. He's the Chief AI Officer in Microsoft. It's really our honor to have you with us today, Mr. Amit, and we're really looking forward to discuss a very important and unique points today when it comes to hospital operation.
Absolutely. Thank you for having me. It's my pleasure.
So I want to start with you, Mr. Shiraz. Thank you for coming again. As you know, hospital operation today face many challenges. And when we talk about advancing healthcare operation, we need to talk about so many elements and critical points when it comes to patient experience and patient journey. From your experience in hospital transformation and operation, I know, please, if you can share with us, what challenges do you think it's really very important now and very critical when it comes to advancing hospital operation?
Firstly, thank you for having me on, and it's great to be here. I'll start with just a very simple concept of how I see operations and what its role is. The role of operations is to manage capacity with the demand and do it in the most cost-effective, efficient way possible. Right? Ultimately, that's what operations is. A lot of work that we do in hospitals is about meeting patient needs, making their volumes manageable with the right amount of staffing, the right amount of resourcing, providing the right level of quality, and making sure the patients are satisfied with that outcome. And typically, what do patients want? They want something quick, they want something high quality, and they don't want to pay more than they think they should be paying for it. They should be feeling like what they're paying for is what they're getting in return. So operations plays the critical role in managing the resources to allow care providers, nurses, doctors to provide that care. Because frankly, patients are willing to pay for that. No patient is going to say, this hospital has an amazing supply chain department. I'm willing to pay that. And the hospital has an amazing quality department. I'm willing to pay for the quality stuff. They're assuming that's going to happen. So as a hospital, we're always under a lot of strain to make sure we're managing those costs, yet providing those services at an effective quality and an effective speed and pace. So for me, supply and demand, managing the capacity, managing the demand. And the role of AI is make those decisions quicker. A lot of our demand can't be met because of a lot of manual processes, a lot of waste in our processes, manual work as well as redundant work. The role of AI now can really be to fast track that. Things that we would struggle to put in enterprise-wide solutions that might have taken years. Now with AI tools, we're actually able to get that stuff done faster, automate things a lot faster, provide value to the patient a lot quicker. So to me, that's the role of marrying up operations and AI.
Yeah, thank you. When we talk about improving operations when it comes to patient experience, and I'm talking about in optimizing workflow, improving coding, improving registration, decreasing waiting time. This is all a different kind of elements that is really affecting the good process of any hospital when it comes to operation. Do you think that really today everybody's talking about AI? Everybody's talking about innovation. I mean, everybody's talking about we want to do this and we want to get this integrated into the hospitals. But where are we really today? I mean, when it comes to integration of technology, into the hospital operation, especially to improve the outcome of the patients and the patient experience when it comes to operations. So how do you think that this can really happen, and where are we now with this?
I think it's a great question. Different healthcare systems have different rates of adoption of AI and technology based on the problems that they face. And if you look at, for example, UK or Canada, their problem is very much they have a lot of demand and they simply can't manage it. So sometimes experience is not as luxurious experience is not top of mind. It's making sure patients are in and out so we can see more patients. In private commercial healthcare, as we see in large case in UAE, the challenge is, well, we need to provide a good experience, an exceptional experience, yet you're in competition with other hospitals and other networks as well. So you have to provide an experience that is over and above just something fast and efficient. Patients have to feel like they're getting something more. So the role of technology in that has to be providing solutions to both problems, I believe. One, in helping patients get in really quickly with the least number of touch points as possible. And for that, hospitals in this region, they're adopting what I call digital doorway. Ideally being able to come in, and it's already in practice in a few hospitals, being able to come in and not having to talk or register with any clerk. You can come in, log in online, you know where to go, it'll tell you where to go sit, and the nurse calls you in. Stickers generated, you're ready to go, right? And you can pay for your deductible online as well. That eliminates the need to have to meet 2 or 3 people and get your insurance verified by them before you take a seat. So that's one of those ways to make things efficient. Also, it provides a channel for patients to interact that they're used to, right? With the population base here, everybody has a phone. Many people prefer to use channels like WhatsApp and digital channels to actually interact and engage. So the role of technology now is to provide more avenues to do that, not just call center, not just waiting for a human to pick up a call. On the experience side, what I'm noticing here in the region is more and more capabilities to provide a better experience, not just when you visit the hospital as an outpatient, but also when you're an inpatient, right? And it also solves the practical problem. As a patient, your needs are more than just a nurse having to come and cannulate or change your IV, but blanket, room temperature, food, cleaning. These are all services that oftentimes nurses are not able to do because they're stretched. Yet with the use of AI, you can actually now provide input, this I need food, I need room temperature control, and actually route the service to the right person, a porter, somebody in facilities, maybe a vendor to provide that service. So here you have AI providing options and capabilities to a patient that could be seen as a luxury offering now. Maybe one day it'll be seen as default, but you're actually saving costs as a hospital, not interrupting nursing time, improving nursing care because they're now focused on clinical care, and allowing other members of the organization to serve that patient in a quicker time. So these are 2 very practical examples we're seeing already in application in quite a few hospitals.
Okay. I want to ask now Mr. Amit, but before I ask him, do you think that from your experience, do we really have an open dialogue with AI industries? I mean, when it comes to adaptation of this application and AI technology. So how do we do that really now? How do we just like involve these AI industries with what exactly we need for these hospitals, for the operation to improve the outcome of this, like the clinical operation, or do we have a specific process that they have this ready, let's say, I don't want to say like application or just ready device and they want to sell it to us. So because the main reason of, or if I can say the goal of the EICAL Congress is we are bringing under one umbrella the academic institution, healthcare organization, and the AI industries, where we can, from the very beginning, discuss the challenges and how they can support us. So, Mr. Amit, hearing me saying this now to Mr. Shiraz, what do you think about involving AI industries from the beginning of this journey when we really customize this kind of solution for hospitals? So how can you, what do you want to say about that?
Thank you for the question. And my point of view is a bit different. I actually don't see our industries to be doing two separate things. For us as Microsoft, when we look at a focused industry, we really look at the outcomes that healthcare organizations, providers, and physicians are looking towards, like Mr. Shiraz mentioned about really improving the experience of the patients, driving the costs down. So there are KPIs that our providers are supposed to manage. Those are the KPIs we target with our solutions. So to me, we absolutely partner very closely. Your question about, when do you bring in industries? We as Microsoft are very fortunate. We've been with the healthcare industry since the beginning 50 years ago, and we are still there very closely. And it's a proud moment for us to actually see. Just last week, there was a report published to look at industries which are taking on AI. Healthcare is the fastest industry that is taking on AI solutions, from operations to changing experiences for patients, for clinicians, and also taking that into research. It would be a miss for us to only look at our current state and not look at future problems. And we are fortunate that we have such powerful tools that have come to our disposal so that we fix what we have today and get ahead to get a better tomorrow. And that's where we are to make sure that we are supporting healthcare end to end in terms of providing sick care, keeping patients really healthy today, and discovering new treatments of the future to make sure that we are keeping up with the global populations.
Mr. Amit, could you share example of Microsoft's current collaboration with healthcare organization and in UAE or the region?
Absolutely, happy to. So to start with, I just want to share with our audience that Microsoft looked at the diffusion of AI globally, and we did a study of all the countries. We looked at the GDP of the country, and we looked at what's the per capita utilization of AI. And we found out that UAE came to the top. Close to 60% of our residents and citizens are utilizing AI tools in some shape or form. We are even above Singapore. Singapore is a point below us, and European countries are close by. But the way UAE has taken on utilization of AI from the end users to really activating data and advancing their infrastructure is unforeseen. And that has given us a very strong base to deliver some leading use cases in our client base. I'm sure Shiraz and Burjeel Hospital have some leading examples because it's a very agile organization and you're doing quite a lot to really transform experiences. From my perspective, we are looking at how do we maximize intelligence from the data that we have. And one of the use cases we're working on as we speak is automation of multidisciplinary teams. As some of you might know that when a person is detected with cancer, there are multidisciplinary teams that actually meet to figure out course of action, course of treatment, because cancer is fairly complex. And we have 13 to 14 doctors sitting in a room looking at case throughout the day to make the best course of action. And as you can imagine, it's an expensive meeting. It can be efficient, or sorry, it can be inefficient, and there could be accuracy challenges. So to manage that, we are actually introducing agents. Agents study the data, get the intelligence out of that data, and feed it to the decision makers. So when they only have 15 minutes to discuss about a patient, they're not spending those 15 minutes to extract data, read, and then synthesize the decisions. They're given the information and a draft of a solution that they could actually adopt. So they are within those 15 minutes, they are able to get very creative to treat the patients in the most appropriate fashion, cost effectively. So we are looking at some leading solutions that we are developing here in Abu Dhabi and Dubai and sharing those across the world. A few years ago, we would actually look at other regions to bring in their best practices and then deliver them here. But I'm very proud to say that we're actually developing some homegrown solutions that we are shipping out of Abu Dhabi. And I think that the tide is changing rapidly, and agile organizations like Burjeel and others in the region can absolutely contribute to that momentum.
Thank you, Mr. Amit. Mr. Shiraz, do you think that this kind of collaboration at early stages can really happen with AI industries in terms of like from Burjeel Hospital? I mean, what do you think about this collaboration with the AI industries?
Burjeel has several active, very active collaborations, as Mr. Amit rightly mentioned. The one thing that I believe really works is the ability to get into the weeds and partner with vendors to really understand the problem. Now, there's some, I would not say out of the box, but there's some standard problems that hospitals have that they're using AI for already, like revenue cycle, AI scribing. Yet there's a lot of problems that are specific to the processes of that hospital. And this is where things like agentic AI solutions, what is the process that a patient goes through or a customer goes through to make an appointment, and how can we develop an effective AI solution to actually understand what the patient might need and schedule appointments or provide them reminders or help them reschedule things based upon intelligence, as opposed to waiting for somebody to pick up the phone and make that call. So there's a lot of potential for understanding the specific workflow for healthcare systems and hospitals, because we're all kind of operate differently, and collaborate with AI and technology firms to figure out what solution can we implement. And oftentimes the best solutions we see are the ones where either the vendor has somebody who has very deep clinical knowledge and is working with us, or they work deeply with the clinical teams to understand, or the administrative teams to understand their processes and introduce some solutions. Some of them are at a local level, right? Not every solution that we're currently piloting, where post-visit, instead of having to wait for a coordinator to call you and check in on you and how you're doing and are you taking your medication, how's your compliance, that stuff can be automated safely, right? With the right kind of knowledge base feeding into it and allowing a closed loop communication to see, well, should we refer you to somebody to talk further, or did everything go okay? You're compliant with your, discharge medications and things are going well. So these are real useful things based upon the use cases of the hospital. And I think that the opportunity is endless. As you all know, physicians are the most expensive resource in a hospital. And AI is the one thing that everybody agrees on. Physicians don't want to waste time doing admin stuff. Administrators don't want physicians to waste time doing admin stuff. And patients want maximum time with the physicians. So it meets all three categories.
Exactly. Yeah, a lot of medical staff are really burned out, from all this administration task when it comes to productivity, when it comes to, data. So this is something I think that we really need to work very closely with the industries and to enable us to really create the better application and system that we really support. I want to ask you, Mr. Shiraz and Mr. Patra, one question. And I want really from both of you to let us know how, in terms of ethical, when we speak about ethical and data privacy for patients and for hospital, the demand, for data-driven insights with growing concern around patient data privacy and security. So we're going to hear your answer, and then we're going to ask Mr. Patra to share his feedback about this. Yeah.
That is implied, yet we know that whatever solution you work with, if it's going to access the patient record in any way, we need to be able to be compliant, right? And there's, in fact, one of the limitations that healthcare systems and hospitals have is that many times our hands are tied with how easily we can pull out information for providing training data. There is red tape, but oftentimes there's good red tape, things that we cannot circumvent and we would not want to circumvent. That being said, there are data sets where you don't necessarily have to rely on patient data, but they're patterns, meaning what are the arrival patterns of various patient types based upon their profile. You don't need to know patient record information, but you need to know what are the arrival patterns of various types of patients. And from that, you can use AI to predict who's going to no-show, right? Who might come in, who to double book. And again, the whole point is we want to provide as many patients as optimal an experience as possible and prevent other patients from waiting. And if you book things optimally using AI, using data, right? Training it on data from past arrival patterns and past capacity demand patterns for patients, you can actually provide a better service for everybody. So there are ways to do that that doesn't necessarily impact patient privacy. And in the operations world, there's a lot you can do without having to access the patient record and maintaining patient privacy.
Yeah, thank you. Mr. Batra? Mr. Amit?
Yes. For us, I think when we look at industries like healthcare that are highly regulated and we are really trying to impact patient lives, families, and communities, and we're working with expensive resources that are highly, highly trained in their craft. Before we even rolled out any of our AI solutions to our clients, Microsoft actually took a step back and thought through where would this industry and these solutions go in the next 5 to 10 years. So the very first thing we actually designed is a responsible AI framework. We ensured that we define how these solutions will be executed and what framework and elements that we need to look at. And these were designed with industry leaders and healthcare leaders to keep in mind, and those are embedded into the solutions that we work with. Any solution that we create for our clients today, when we roll it out, we have to get clarification and approvals from our responsible AI committees, especially when it comes to clinical workflows. And just to share with the audience, the 6 pillars that we go through and we ensure that our solutions are abiding to the framework, they are fairness, where any AI solution has to treat all people and data fairly. There cannot be any bias in the outcomes. As you know, that can be really detrimental to a patient's health. The second key area we focus on is reliability and safety. We need to make sure that these systems are highly reliable and safe under expected conditions. And also, today you would see a lot of us use ChatGPT to ask questions, which is fine. It's a good reference. But there are so many studies, not just for ChatGPT, but any other model you take. If you ask the same question 5 times, there's a chance that you might get 5 different responses. And we cannot utilize a system like that in practice. That's where Microsoft really works with our partners to modify these models with the right data, with the right training, to give that accurate answer the first time and have that repeatability built into that. Because healthcare is not about trial and error, it's about accuracy the first time. The third thing we absolutely, like you talked about, is privacy and security. I cannot, stress enough how important that is. And even for countries to keep data on the soil, we cannot host any country's clinical medical data outside the country. And that's where we're spending tremendous amount of our effort and investment to make sure that data is kept on the soil and processed on the soil. The fourth pillar we look at is inclusiveness. And we need to make sure that we are empowering everyone and engaging people to have equity in healthcare. We cannot continue to provide healthcare where infrastructure is great, especially when we have tools like AI. So we strive ourselves, we put in a lot of effort into thinking how can we really make access to people, access to care where they are. So inclusiveness is absolutely important. Number fifth is transparency. And answers that we get today cannot just be one-line answers without traceability. We need to know on what basis has this AI model given you this answer. So you should be able to go back and track it. And lastly, accountability. Many of the solutions that we provide, we get questioned if this solution provides the wrong answer, who's responsible? Who's accountable? And those answers could differ based on the situation, but we are not shy to discuss that up front and make it very clear and design the workflow so that AI is not taking over the accountability. The accountability has to stay with the providers, and we need to enable the workflows where they feel empowered to make those decisions. And that's where everything else that I talked about, the rest of the five pillars, give you that confidence so that you continue to maintain the accountability where it should be.
Thank you, Mr. Amit. Mr. Shiraz, regarding designing this AI solution, and if we will talk about supporting the physician, you just mentioned about the burnout and this administration task that they are doing on productivity. So, and we have Mr. Amit. So, do you have anything in your mind about how really we can collaborate on designing these solutions for physician? Because there is a very major, big concern now in the healthcare system from all physicians that they are really burned out from all this administration tasks that they are doing. Even the care coordination between the physician, the nurse, and even the lab or the pharmacy, it will take them long process to call, to put the, prescription. There's a lot of things that really taking from their time. Instead of focusing on patient care, they are focusing on other administration tasks. And until today, we don't really see this development and advancement that even with solution that can really support the physician. So we'll hear what you will say, and then maybe Mr. Amit can give us some from his feedback about this point. Yeah.
Sure thing. So, I mean, maybe most of us know this, but for some of us that don't, electronic medical records were originally invented for billing, right? These were tools for the CFOs to be able to effectively bill for provision of care and generate an invoice. And then it grew around workflows and bill. But the point is, they were never designed to provide an optimal workflow for the physician because that was not the original intent. And later on, modifications are made. And if you look at a lot of the solutions that are in the market, they're meant to automate those processes or maybe bypass some of those additional manual steps out of there. So I understand the frustration.
System, dictation, yeah.
So the system was designed for a purpose, and now we have more and more access to cheaper and cheaper technology to automate some of those things, and now use AI to provide some additional capabilities there as well. So I'll say, firstly, working with the EMRs and the systems you have in place, we need to have AI tools that are very quickly able to work through the gaps. And this is where every hospital system has this slightly configured differently. So the AI solution should be able to work through that gap effectively. The second thing I would say is, and Amit touched on that very well, is having a well-governed and effective AI committee is important because that is a venue for physicians, if it's well run, to actually come and present their ideas and opportunities. Because I have found in my entire experience in healthcare is that the people who are providing the care at the front line have the best ideas on what's causing the most waste. And they often have a good idea of some solutions that are out there. And physicians are quite clever and innovative in identifying some potential solutions and opportunities. It's the purpose of this AI committee to translate that intended solution to an actual solution.
Yeah.
And then it's the intent of them to figure out, is this an architectural change? Is this an enterprise-wide thing? Or is it going to harm privacy? Is it going to affect anything? So this is where, if you have a robust process in a hospital, it can really enable and empower the physicians and nurses and other clinicians to come up with these opportunities, introduce them, and then have them seen all the way into execution, right? So I would say it's an innovation pathway. And the purpose of administrators like myself is to facilitate that innovation pathway. It just happens to be called AI now because that's what people are talking about, but it's a pathway for people to get things done in a smarter way with less work. And if you have a good process set up for that, you can have dozens of these kinds of things coming out every year.
Yeah, thank you. Mr. Amit?
This is, a very interesting topic, and the way we look at how can we really help hospitals and care providers in their day-to-day, we typically find two situations. One where, like Shiraz mentioned, you have the EMR system where the hospital has invested dearly for decades, and unfortunately, you cannot get rid of it. You have to maximize the data that's there. So let's look at solutions that we can start maximizing intelligence in this ecosystem. And then there is another bucket where you have the opportunity to take a step back and say, can I redo this workflow in a very different way now that we have net new tools? So I'll give you an example of each. In the first bucket, yes, ambient solutions are absolutely taking traction in the market because today you have screens that block the conversation between a physician and a patient. And our partners are developing solutions where the screens will actually, in real time, bring out that intelligence from your EMR system while you and the patient, the doctor and the patient are having the conversation. And you can prove to the patient that your CBC test results are historically not looking good. And you can show the chart while you're talking, the system is bringing up that information just like your assistant. Those solutions are coming to market rapidly. And this has been through the generative AI wave for the last 3 years. This is just the start. And I feel that the systems of today, which are bulky, which doctors absolutely hate, would be the ones that will actually go into the background. And we'll have a lot more intelligence come to the foreground. So that's how we are seeing this wave of change. It will take time. Hospitals spend 15, 20 years to bring in EMRs. We cannot rip them out in 3 years, right? So this will take time, and we are seeing incremental change all the time. In UAE, we have our partners actually developing ambient solutions in Arabic, supporting multi-language conversations. You don't need translators anymore because the systems are translating for you. So this is incremental innovation that we are seeing, which is freeing up time. I'll jump very quickly on a very interesting example on the other side. One of our clients, they are a large healthcare system, 5 different EMRs, multiple scheduling, tens of people actually doing schedules, and patients and their families actually call in to the call center. They're on call for 10, 12 minutes, figure out the schedule, they go back, and then God forbid, if your schedule needs to change, they need to go back to this whole thing again. So they came to us and said, can we really look at if we have to rip away all these solutions, is there a way we could do this in a very different manner? So we worked with our partners and came up with a solution where if the patient calls, first of all, they shouldn't be able to be calling. They should be able to do this smartly from their phone. So we designed a patient assistant, which it's an intelligence engine that knows the schedules, knows how far you are and your availability, and really gives you the options to select the schedule. And that's been, a very common scenario. One of our partners actually said, in case the patient calls because they're not happy with their cell phone, they want to talk to someone. And if we are able to record the conversation for 15, 20 minutes, we can intelligently suggest the times, but at the same time, from the voice biomarkers, we are able to pick up if this patient has depression or any mental health condition. And that voice assistant can actually guide you to provide insights into what's happening. Are you okay? Would you like to talk to a nurse? We feel you are stressed. So that we have intelligent voice biomarkers agents that can identify and even help you schedule a separate appointment. So when you look at this workflow and the data that you have, we are able to come up with completely transforming the care pathways, not just give you an appointment, but also detect your conditions while you're doing that.
Thank you, Mr. Amit. I understand that you are currently collaborating with some healthcare organization where you are, working on all these devices and application. Do you have any sample from all this that already implemented from any other part of this world? I mean, and what is the overall outcome and result?
Absolutely. I don't think we are collaborating with some of the organizations. I think we are collaborating with almost every organization. And what's exciting is that almost every organization is looking at this new tool, which we call AI, to fix their problems. Previously, you would look outside at what solutions are available and then try to fit them into your ecosystem. But today, we are really fixing what we really need to fix. I'll quickly provide three leading use cases. One of them, for folks living in Abu Dhabi, you already know the Sehatna app. Today on the Sehatna app that we co-developed with Department of Health and our partners at M42, this app is available on TAM. TAM provides all the government services, and residents, visitors, and citizens can download the app, upload your lab results or your genomics report, and ask questions about your results in this app. This is live today. And is this clinically relevant information? It is close to that. It can translate the clinical information in simple language, but advancements are coming where this becomes even a lot more clinically relevant, and even physicians can use that for their references. So that's one. Secondly, as you know, there is a major initiative for Emirati Genome Program where there is tremendous amount of data that we have. There are initiatives where we are looking into how do you utilize this data, bring in clinical claims, environmental, and genomics data together, and then build up intelligence into our system, and then go to an individual and say, you are living in Saadiyat Island, you have diabetes. Tomorrow there is an event where it was very beneficial for people who are diabetic in your age group. Will be great if you can go join. Department of Health announced this initiative. They're calling it Population Health Intelligence Initiative. And it is something that we are actually working on currently with that. Lastly, we talked about ambient solution. Our partners in M42 have developed their own ambient solution on our platform. It is highly competitive. It is so relevant to this market, and these things again are being built in UAE and providing to the region and to the world.
Thank you, Mr. Amit. Mr. Shiraz, after all what we have been discussing, do you really think that soon we're going to have what we can call a smart hospital? I mean, realistically, you're Chief Operation Officer, and you have a big experience in transformation in the area and in the region. So having said all this today, do you think that we're going to have really soon what we can call the smart hospital, where we can have the excellent operation and, supporting medical staff, supporting, clinical staff, and even administrators? I mean, where do you see this happening? How do you see it happening and your vision about it?
I think, like we talk about smart cities, smart hospitals are like small towns, right? They have people that stay there longer than a day. They have their own security. They have people that provide different services. They have logistics. A smart hospital is a hospital that treats the right patient at the right time at the right cost, right?
Yeah.
And each kind of hospital has a place, right? There's advanced care hospitals, which Burjeel Medical City is, that needs to provide the advanced level of care to the patients that need them at the lowest possible cost to support, yet the highest level of quality, right? So when I say smart and intelligent, I mean ultimately, what do you need in a hospital to serve the patient's needs in the most effective way? And as a patient walks or works through the hospital and gets a procedure, or gets an X-ray, or gets a lab test, that entire journey is peppered with delays, bottlenecks, coordination gaps that people have to solve. And if you look at a hospital, there are hundreds of these coordinations that are happening every single day to serve a patient effectively. A smart hospital is a hospital that thinks horizontally,
Exactly.
right? Not vertically. So what fits the horizontal gaps? That's the challenge, right? It's been the challenge of administrators since the beginning of the concept of a hospital to connect those verticals, right? Make the doctors talk to the nurses, talk to the admins, talk to finance, talk to supply chain. But smart hospital is one where you can finally now use technology to make that seamless and make that work horizontally and figure out where all those gaps are in communication, in handoff, in manual work, in lack of data, the incorrect data, and make sure the patient is coming and going with the best health outcome, with the most accurate information to continue to improve their outcomes so that we can learn and continue to provide a better service for the future for the patient. So I would say smart hospital means a horizontal hospital where all these dozens of verticals and departments are being connected through technology better than ever before.
Yeah.
With the right kind of data that we can finally use to train AI with so that it can continue to provide better outcomes. That hasn't happened yet in a massive scale, but we're certainly working hard to get to that point.
Yeah, this is, as I said before, an open dialogue between healthcare organization and the AI industry. So you have Mr. Amit representing the AI industry, expert in this field. So what do you want to ask him? Or how do you think he will support you on all what you said? You can ask him one question.
Oh my God! As you were
Yeah,
talking,
only one question.
I had a fantastic number of questions to ask.
Yeah, I know.
How do you see agentic AI finally reaching a point where hospitals can automate their entire scheduling and rescheduling and appointment optimization process? Like how far are we from that possibility, complete automation of that?
Thank you. Thank you for a very relevant question. In fact, just earlier today, we were in a client meeting where we were looking at automating the whole scheduling workflow, and it's been a major challenge. I think we have the tools today to start developing these solutions that are very effective and contain the context and the intelligence. I don't think we are that far. I would say within the year, we would start seeing agents that really transform this experience for patients. Because as you are the COO, you know the velocity through which you can utilize your existing resources and make the changes when things need to change timely. That is a very it's one of those workflows that is high impact and much needed. So we're actually targeting workflows that are high impact and can really make a difference. And e-scheduling, scheduling assistants are absolutely top of mind. And we are seeing the evolution of agentic AI where these agents are able to keep the context for a very long time. So they should be able to remember the patient and their preferences and not ask you the same question and again and again. So that's one. The second thing is these agents are also now able to reason. They're able to reason with you. They're not just waiting for your command. They can say, "Oh, so you want this time because of these reasons, and can we try and schedule while you're coming for your blood test? Can we schedule your labs at the same time? Can we schedule your radiology at the same time?" So we're looking into a lot more efficient workflows just on this specific topic. And this is just one, right? When you look at the entire patient journey, let's just say for a hospital, we're just looking at step one that we're trying to automate. There are other steps that leaders like you are looking at depending on their situation. So I'm very positive that we will absolutely see successful use cases this year. But when we talk about widespread adoption of these transformative workflows, I would say 1 to 2 years time.
1 to 2 years time.
I'm looking forward
Oh,
to that.
excellent.
It's great to hear, and I'd love to see some
Absolutely.
examples as well.
Exactly. Yeah. Okay,
I'm
Mr.
always
Amit, you have.
optimistic. I'm always bold, and it won't be the first time that I'm proven wrong. But to me, I'm always looking at the bright side.
This is reminding me of what Elon Musk said just like 2 weeks ago about studying medicine, like, in 3 years' time, that we will. I mean, do you hear what he said?
Yes,
Three,
absolutely.
because I received this question just now from one of the audience that I think we should start taking one or two questions. He said that Elon Musk mentioned like 2 weeks ago that he advising not to study medicine because AI and robotics will be replacing everything in 3 years' time. This is a question I have from one of the audience.
So for those who missed that, I'll set the context. So the context, yes, he did make the statement, but I'll share the context where
Yeah.
they were talking about the precision of surgical robots, like how far are they in terms of being as good as humans or even better. And he said it's very close. And in 2 to 3 years' time, he sees that these surgical robots will be everywhere. Now, as Shiraz knows, Da Vinci robots and these robots are already in operating rooms. And to make them democratized everywhere, I think in 2 to 3 years' time, but to say that medical education will be made redundant in 3 to 4 years' time, I disagree with that. I feel that AI and enabling technologies will always improve us as humans. I don't think that the medical education will go away. The way I look at it, it would be the next generation evolution. Yes, the way it stands today, it cannot continue. It has to evolve with times. So I see an evolution. I see a lot of intelligence that comes in. I also see human creativity actually being utilized a lot more.
Thank you for saying this, Mr. Amit. Yeah, because yes.
Yeah, I'm gonna, if I can add to that as well, I would just add that AI I don't believe is going to make physicians archaic, but it's going to provide access to a lot more people to their skills. Where a radiologist could see 50, now they can see 500 a day, images a day, and with the help of AI. So from a global population health perspective, from access to care perspective, it's going to be transformative. So I don't think the medical profession is going to go anywhere. I think what's going to happen is many, many more people are going to have access to the best medical care because now it becomes affordable to provide that care.
Exactly. And thank you, Mr. Amit, for saying this, because really we want to make sure and emphasize that AI and innovation, they are here to help and to support
Absolutely.
medical team and clinical team, but not to replace, or as we always say that, decrease the staffing. Yes, AI and innovation is to help and to support. And as Mr. Shiraz said, for a better, outcome, but it will never be one day replacing humans. So thank you for saying this, and thank you, Mr. Shiraz, as well, because this is really a very important point. And I really thank you for joining us today. It was a very productive discussion. And we're really looking for more discussion during the EICAL Congress. We have a dedicated session for hospital operation where we can also we have international speakers and experts coming and discussing, and we will have you as well, Mr. Amit, Mr. Shiraz also will be there in the panel. So thank you again for this very, very good session. And inshallah, thank you everyone for attending. Well, inshallah, we'll see you all during the EICAL Congress in March. Thank you so much. Thank you, Mr. Amit.
Thank you very much.
Thank you, Mr. Shiraz.
You're very welcome.
Thank you.